matter what you're going through
or what you have been through,
thank God is fabulous. I'm Welda Paley. And I'm Fasia Hilton. Welcome.
Thank God is fabulous.
Male nurses.
Patient comfort, values, and beliefs.
Thank God is fabulous.
what is cancer? What is your perception of cancer?
Well, today our guest will be sharing her story on living with cancer.
Thank God is fabulous.
Friendship. What is a true friend? He's my friend. She's my friend. Can a male and a female be true friends?
What are the benefits of friendship? Are there true friends with benefits or not? How do you know somebody is a friend? What are the criteria? What are the requirements to have a friend?
Thank God it's fabulous. Well, today we are going to be talking about career choices.
Do you make career choices based on your habits, or things you love, or what's trending, or what would be your livelihood?
Is it going to be vocational or is it going to be higher education? What's your choice?
matter what you're going through
or what you have been through.
Thank God it's fabulous. I'm Welda Patey, and I'm Fasia Hilton. Welcome.
Thank God it's fabulous.
Male nurses.
Patient comfort, values, and beliefs.
Thank God it's fabulous.
What is cancer? What is your perception of cancer?
Well, today our guest will be sharing her story on living with cancer.
Thank God it's fabulous.
Friendship. What is a true friend? He's my friend. She's my friend. Can a male and a female be true friends?
What are the benefits of friendship? Are there true friends with benefits or not? How do you know somebody is a friend? What are the criteria? What are the requirements to have a friend?
Thank
God it's fabulous.
Well, today we are going to be talking about career choices.
Do you make career choices based on your habits, or things you love, or what's trending, or what would be your livelihood?
Is it going to be vocational or is it going to be higher education? What's your choice?
Welcome to another episode of Thank God
It's
is fabulous.
Yes.
It doesn't matter what you've been going through.
Or what you have been through.
Thank God is fabulous.
In
So
all
we-
things, give thanks to the Lord.
You know what I'm saying? Another Friday to be in the land of the living.
Yes, above ground. Yep.
So today we're gonna be talking about Ozempic.
Yes.
Ozempic is one of those drugs that I love the jingle so much that anytime I hear it, I gotta sing along with it. But the funny thing about this jingle, in my mind, I knew the original song.
You know, I
Before
haven't heard
the
the
jingle.
I haven't heard the jingle.
Oh, Ozempic.
Yes, that's true. Yes, I
You
have heard
know.
it. Yes.
But original song for that is Magic.
Mm-hmm.
It's magic. You know. So I like every time I hear it, I used to know a song that went the same way, but I couldn't figure it out. But I've been thinking about it so much until I went and I look it up, and I knew it. This was not Ozempic before, but Ozempic just matched the song, so they just put it in. It just sounds like Ozempic.
Yes.
I don't think you would ever be able to sing the song the way it was meant to be with all saying Ozempic, because they just fit together so good. So we're talking about Ozempic today and all the uses of Ozempic. The amazing thing about this drug, the scientific name is semaglutide. It was made for one purpose, but now it has so many other
Yeah,
purposes.
so many
Can you
flavors.
imagine that?
Yeah, and good
Good reasons.
Great reasons, yes.
It is amazing. We're
Yes.
going to share a couple of things with you today that we found out about this drug. You will be amazed. And we're going to have Jeremiah Sile coming on the show today to also talk about it, saying he's in pharmacy.
Yes, our own
and that his
pharmacist in the
area in
making.
drugs. So we're going to talk about it and we're going to throw things around. But it's amazing how the drug intended purpose has now become bigger and way better than the original purpose of the drug.
Yes.
And you know how this country, obesity is a serious problem? This drug has hit obesity like nobody business.
It has.
It even want to turn itself from being what it was for, which was type 2 diabetes, now to being a weight loss medication. Can you imagine that?
But before we start, we just want to throw out this disclaimer that in no way are we sponsoring the drugs or the pharmaceutical company has sponsored us to speak about it. We just want to inform the public. In no way are we saying, go and get it. You have to talk to your physician before you can get it. You have to qualify for it, or you have to fit the criteria for the medication. But we just want to shed light on it, okay?
Yep.
So again, the disclaimer is that we are not being sponsored.
We are not promoting
We are not
Ozempic.
promoting it. We're just shedding light and giving information to the public
Yes.
about this medication.
Yes. Because one of the biggest things we have found today with African Americans, especially, is this type 2 diabetes. And every other body, every other group and population, type 2 diabetes has been so widespread. And we've seen the havoc it can wreak on other body systems.
Yes.
And how it can change a person's whole life around. So if there is something that can help, but please come and help. Because for a minute there we have had a lot of things on board trying to solve this one crisis.
Yes.
Because it is a crisis now.
It is.
For the number of lives it has taken and the number of damages it has done to body organs, yes, it is a crisis. So we will talk about it today. So at least to shed light on it, so you're not ignorant of the fact that when you go to see your doctor for your annual checkup and your doctor check you and tell you some things, you got a little idea and little clue about, oh, but I heard about this. Can you talk to me more about it? And then your doctor will talk to you more about it. Your doctor will do all the necessary tests that you have to qualify for in order to say if you can or if you cannot. But if you just got out of your bed and you just wanted to be eating a lot of fufu at night, eating a lot of heavy food and don't exercise, don't work out, don't do nothing, and you've gained a lot of weight, now you just want to take something to make a quick fix, they will still send you to do dieting and exercising with that medicine. So it's really not a quick fix. It helps. So there's your part. Your part never going to change. You got to change your lifestyle, because the biggest thing is lifestyle.
That's it.
If you change your lifestyle, you can change a lot of things. We
Yes.
know we are rice eaters, and we know rice breaks down into sugar. So when you eat it late and you don't burn it, it will go wait for you later on. And at the end of the day, you'll be working with something that over time your beta cells may not be able to handle after a long time. And then you start seeing yourself having high sugar, because your beta cells in your pancreas is the one responsible for making your insulin.
Yes.
So if you work them so hard, don't worry, over time they're gonna die. And then you don't have enough anymore to make your insulin to pick up your sugar from your blood. And that's when it starts to wreak havoc on your body. So when you're eating rice late, get up and walk around. Do something to burn that rice out of your system before you lay down and sleep.
Oh, yes.
Okay? Because it don't take long before this thing will creep up on you. And that's what it does. It creeps. All right? It leads to so many other disease, because when it causes roadblock all over the place, now blood that's supposed to transport itself and things can't go like they should. So now the heart has to increase the pump to get things to go forcefully. Then you put in more workload on the heart. When the heart got too much workload, you got hypertension coming, you got cardiovascular problems coming, and the kidney will be affected because the heart and the kidney, they are good friends. They work closely together. So now you're affecting this other body part. And that's how all the different organs that are closely related, that work together, they all get affected. And before you know it, you're dealing with a whole situation that you didn't bargain for. So fix what you're able to fix. At least at the end of the day, you can guarantee that when I used to eat, I did exercise, I did work out, so my food didn't sit and turn into sugar.
Yes.
Okay. And we
Oh,
know
and
a
so-
Saturday fufu ain't no joke. And when you eat it, your food can only do two things: either energy or fat.
Yes.
So by the time you start eating, and by the time you put a spoon down, you want to take a nap, your food is not being burned for energy. It will store up as fat. So you either eat at the time when you're able to move around so that the food can be burned, or you don't eat heavy stuff when it's late because you will not burn it and it will store up as fat. And over time, that's too much work for your pancreas. So just a word of caution.
That is true. So, with diabetes, one of the important topic in diabetes is how to treat it. Okay, and so one of the group of drug that we use to treat diabetes is called the group of drug is called GLP-1. Okay, and GLP-1 is what we call glucagon like peptide. All right, you think, oh, so what does that mean? Glucagon like peptide GLP-1, in essence, the word that we use is called incretin. Okay, that's the function. What it does is it increases insulin. It stimulates the beta cell to increase insulin, and then it also decreases glucagon. And so if you put those two together, that's your optimum treatment for diabetes. You want to increase the insulin level and you want to decrease the glucagon level, the sugar level. Okay? So one would say, well, if you're saying, glucagon like, does that mean that it's the function? No. Glucagon like only means that they are like in structure, but it is an antagonist, meaning it work against. So that means that's why it decreases the glucagon level.
Yeah.
I hope I'm trying to break it down as much as I can remember.
Yeah.
Remember it. Okay, and so that's what you want. You want it to increase your insulin level and then decrease the glucagon level. All right, and which, I mean, that's the best thing. But then what they have found out is that this GLP or this Ozempic, it works like that, but it also suppresses your appetite. So it sends a message to the hypothalamus to suppress your appetite, and then it slows down dumping, from your, it slows down your stomach.
Yep.
All right. So when you eat and the food gets to the intestine, then the GLP is the body makes natural GLP-1. Let's just put it that way.
Yep.
Okay. It is supposed to send the insulin so that, it can bring down the sugar, and then it's supposed to decrease the glucagon. Okay. So what happens when you eat and the food reaches your intestine? The two phases the GLP-1 is activated or is released. It's released in the first 15 minutes after you eat, and then 30 minutes later. Okay, so it helps to decrease your sugar. But then, like we said, and that is actually a side effect of the Ozempic, is that it slows, down the stomach from dumping, and then it also it suppresses your appetite.
And can you imagine the side effect are now become the best effect?
Exactly. Yes. So, when I was reading up on this, they call it the Power 3,
Yep.
the Trizone. What it does is the action is it lowers your A1C. And what is the A1C in type 2 diabetes? A1C is an average of all your sugar level for the past 3 months.
Yep.
It gives us an average. So it decreases the A1C. And then two, it also manage your risk of major cardiovascular events. Like that you have in heart disease, like stroke.
Yep.
And then the third one, it says, is that weight loss.
Yes. Yep.
I mean, those are three great
It-
benefits
it is
from
hitting
Ozempic.
targets.
Yes, it is.
But you remember how I just said that your beta cell in your pancreas is the one that's responsible to make the insulin to come carry the sugar when it's in your blood. Guess what it also do? It slow down the death rate of those beta cells.
Yeah.
Because when they die, they do not regenerate.
Regenerate, no.
So that's why people can get type 2 diabetes, because they all not go work, nobody living no more, all dead, they cannot make insulin.
Yeah.
But with this drug helps to slow down their death rate. So can you imagine? It's slowing down the death rate, so that means you still have beta cell to make insulin to go get sugar.
Yeah.
And the good thing about it, you take it one shot
Every week.
Every week.
Yes. Every week.
So some people say, I don't like needles.
It's a very tiny,
Very.
I mean, very, it's very minute, very
Yeah.
tiny, that
Yeah.
when you stick yourself, you won't even feel it.
Yes.
You won't even feel it.
Yeah. And for the drug just being able to hit cardiovascular. If you can address cardiovascular, you will address kidney.
Yes.
Because if you don't, that's the next organ that's coming. Kidney is going to go down the line. So if you can fix that and address that, and you can hit diabetes, and you can get a bit of... This drug is working just too hard to put out of business.
Yes.
That's
I mean,
what's going to happen.
When you lose the weight, a lot of things are
Change.
solved.
Yeah, a lot of things
because
change about
then
your life.
it can it will stop you from using the insulin or taking, it will bring your A1C down to normal. So then your type 2 can be reversed.
Yep.
Okay? Then it prevents you from cardiovascular, accidents. It prevents death.
Yep.
And you feel better. You can do things, you can play with your grandchildren, you can walk a longer distance without huffing and puffing.
Yep.
So
It's a lot of things to... Because we have been preaching forever, change your lifestyle. Change your lifestyle.
yes.
Eat better, exercise. Eat better, exercise. But some of us have wasted so much time until it's like the exercise part is now very difficult to us. We can look at it and be like, I'm able to do all that exercise. But let me tell you something that will shock you. You can still sit down and do exercise. Did you know that?
Yes.
You can sit down and work out.
Sit in a chair, yes.
Sit in the chair, lift for that leg, put it down, lift for that arm, put it down, and burn the same X if you don't want to get up off your butt, because now you've gained so much weight and you feel like this is hard on me getting up to do my exercise. You can still sit and do it. Just do not sit there and do nothing. Just do not something. Every little bit will count, and I will tell you, the key to whatever you do is consistency.
That's it. Yep.
So don't go break mountain today and tomorrow you're like, I ain't doing this thing again for the rest of the week. It doesn't help. It doesn't help. Even that little bit of walking that you do, 30 minutes of walking is an exercise. Do something. Just do something. Don't just sit there. Because whatever little you do is going to help you. Even though all these medications are coming, I think this is one of the first time I've heard a medication side effect is the best.
Yes.
Medication side effect is never the best. That's why it's called side effect. But this other side effect is great because a lot of people want to lose weight. So can you imagine people who don't have diabetes, who don't have heart problem yet, who don't have kidney problem yet, is wanting to take the medication just for weight loss? Can you just exercise and eat right? Change your lifestyle? Because if you even get a drug and your lifestyle is a problem, you're gonna be in a circle.
True. True.
So if you change your lifestyle and in that token you take the meds, great.
It's a
Because your
win-win
lifestyle
situation.
will stay with you. You will always do that lifestyle. It takes 21 days for you to make a habit. So if you start eating right and exercising a little bit, and you do that consistently for 21 days, you will find out it will come to you naturally. You will just do it and you will just eat right. When you see food that is not good for you, your body will not crave it. Your body will say, go away. Let me tell you what I also found out. You know how people can say, oh, I got sweet tooth, I got sweet tooth. Do you know it's worms in you that make you want to eat that sweet? I'm like, kidding me? What? But then again, I don't buy it because we grew up in Africa. We don't really do a lot of sweet because we didn't grow up eating sweet.
Right.
You know, we did a lot of natural stuff, fruits, vegetable. So to just go buy a chocolate or a candy bar, it's just not in a lot of us. So I don't want to buy that is a worm because you still got worms. So, but that is besides the fact. That sweet that comes, if you're a sweet eater, no problem. Work it out. Exercise it after you eat it. Don't just eat it and sit down because it'll be a problem. Because that sugar gonna store for you and wait later on. And at the end of the day, the havoc is worse than anything else. Because it's when the sugar is in the blood, that's when it has the problem. Not when it goes to your cell. When it goes to your cell will use it up for energy. So they ain't got no, it's doing what it should do. But when it's not going to the cells, and the only thing that can take it to the cells is the insulin and exercise. Exercise is the only thing that can force insulin to come out, whether it wants to come out or not. Insulin is the vehicle. So if it decides I don't have gas, I'm not going to drive today, exercise will put gas in it by force and send it out, and it will come and collect the sugar and go take it to the cells. So that's why people keep preaching exercise, exercise. And the dieting part, they're preaching it because if you fill the system with so much, that's overload. Insulin will tell you, all right, I ain't coming to work today. That's too much work over there to haul all that sugar. I ain't going to work. And go sit in one corner and go take time off. But when you eat right, you chew more. You give your body good fighting power.
Yes.
Your body don't have to work so hard to turn the food into charm. It's just a little bit and then it gone into your body and then your cells can get it. All the nutrition can be gotten. And you know what? The more you chew your food, the better it is for you. Because you got hormones in your body. Your leptin and your ghrelin. They are your satiable hormone. You chew more, you release it. After chewing 1 spoon of rice, then you say, oh, I eat nothing. Because you did a lot of chewing to that rice. And when that hormone is released, you got no worries there anymore. It will automatically make you feel full, whereby you didn't eat much. So start learning how to chew. Don't whack, swallow. It will give you more work to do. You will eat more, and it will take a long time for your body to break down all that thing you put in there. But without further ado, I will go ahead and bring Jeremiah into the program so he can share more light too on semaglutide. Semaglutine. Welcome, Jeremiah.
Welcome, Mr. Silly.
How y'all doing?
Another day in paradise, and it doesn't matter what you're going through today.
Oh, what you've been through.
Thank God is fabulous. So, welcome. Please introduce yourself to our audience who don't know you, and let's dive right into it.
My name is Jeremiah Sadiq. Just
That's exactly it.
All right. Well, I just
yeah.
want to say thank you for answering on such
Short
short
notice,
notice.
yeah.
I called him yesterday and asked him, if he could come on to shed some light on it. And ironically, he said he had just done a presentation on Ozempic.
Okay, so
So
right
thank
up
you
his
so
alley.
much.
All right. So we are all ears.
So sorry that I was not. Is there echo?
No, not on our end.
Okay, okay. So sorry that I didn't follow to see how far you guys are, but with diabetes is a very complicated topic, and then to break it down into lower parts for the normal audience is also difficult. It's one of those disease states that is not that easy for. It's not that easy for. I hear it myself. That's the problem.
Oh,
No,
but
you're sounding
you
clear.
sounding clear to us.
Okay. So I'll just continue again myself, but no problem. So it's so complicated in a way that there are a lot of pathway of the body. There's a lot of physiology in the body that really affected by the diabetes as a whole. And one of those places we spoke of was your kidney. And because your kidney do a lot of absorption and excretion of a lot of material, so when glucose is stuck in your blood, most of the time, if it's not being accepted through the receptor and they are staying there, they go through the bloodstream, and the kidney is one of those pathways that specifically goes through that. And if your kidney is over being worked, then it means you're going to have a kidney issue. So, what scientists looking at is that look, even though we are treating a diabetes, but there are other physiological complications that are associated with the disease. So, what can we do to manage it? We're seeing cardiovascular events, we're seeing pain, we're seeing neuropathy, we're seeing a lot of physiological issues. But where is the metabolism and the drugs actually effective? So it was not only Ozempic that was being looked at actually, but when you look at Ozempic and metformin, other drugs, each drug has their own classes. So we have to look at the mechanism of actions, the pharmacokinetics, the pharmacodynamics of each of those drugs that are in a specific diabetes class. So actually, most scientific industry, especially scientists, started from the SGLT2 inhibitor, which is a sodium glucose uptake inhibitors. That where they started from, and they started studying. So they started studying just like Fasiga, just like genders, just as before they started going to GLP-1, which is the group that Ozempic is part of. And when you talk about GLP-1, you're talking about glucose, glycogen, uh, how you call it, glucagon, how you call it?
Antagonist.
Yes,
Glucagon
glucagon antagonist.
yes.
So when you talk about glucagon, I hear it myself, so it's so hard. So when I say it to you, then I hear it two times. So I try to keep my thoughts. So basically, um, what happened is we're talking about diabetes. A lot of people know glucose, but they don't know what happened to the glucagon, right? So what is glucagon? What is glucose? Glucose is the one that basically take the bloodstream up and goes into the bloodstream. But then what glucagon does is that glucagon take the sugar from the cells. They take it into the cells and dump it back into the bloodstream. So while glucose is taking it from the bloodstream to other part of the body, then glucagon is not taking it as well and bringing it back into the bloodstream. So you see that's an imbalance. What glucose is doing, glucagon is doing the opposite. So you want to have a homeostasis level. So what happened is this particular Ozempic is focused on glucagon characteristic, how is the drug, how is behaving, that physiology. But what happens is when the diabetes is stuck in the bloodstream, it goes through the kidney. So now we gotta look at the kidney physiology. So that physiology of the kidney, that's when they start looking at, because for people that have kidney disease, diabetes will cause that, or cause cardiovascular, or cause so many things. But then which are the drugs have that characteristics to protect the kidney from damaging? That's how scientists started looking at it. Now the reason is the drug is not on the market at this point, according to pre-approval, and what FDA is doing is diabetes is so complicated to the extent that they're trying to look at people that have other comorbidities, people that smoke, people that are taking alcohol and other metabolic enzymes that could affect the drugs. But other than that, it's a huge innovation that is taking place within the scientific revolutions. We have been all on the news that Ozempic is promising, and there are a lot of few studies that need to be done for it to be approved for that particular protection of your kidney functions. So I don't know if there's a specific questions you guys want me to go into.
No, you're doing good with just the general stuff about what the medication is doing, especially because what it was originally designed for is doing hitting all other places that we've been struggling with for a long time. So I think that was the effect of us wanting you to talk more about the Semitic glide and its function, that it has come on now to be big instead of just taking care of one area, it's taking care of three, four different areas.
Yeah, this is this is normal, right? When you in the pharmaceutical industry, those are other are exposed to the pharmaceutical industry, especially in the area of pharmaceutics, right? Most industry has a backup on therapy on medication. I will give an example. I know you guys are in the medical field, so you guys know how the how penicillin came about.
Right.
When penicillin was discovered, it was actually for different indications. And later on, when they put it on the market for clinical trials, then we start seeing that it will help in the age of antibiotic, will help against infection, and then it just become something. Another drug that had that same thing was how you call these drugs, man? Cialis, uh, which is the one we call the erectile dysfunction drugs. You know what I'm talking about, man?
Cialis.
Viagra, Viagra, CLS, sildenafil, all of them are the same drugs. So, for erectile dysfunction, they produce that drugs were actually produced for cardiovascular effects. It was there to help heart rate. That's the reason why when you take Viagra, you can have an increased heart rate. But when they put on the market through clinical trials, because that will go through clinical trial 1, 2, 3, and 4 and 5. So when it goes through clinical trial 2 and 3, then they notice that they just, even though it was for cardiovascular, it was even good for men, because men were reporting that they were having good sex and they were doing well, doing sexual activity, and it could help them for erections. So when they carry back for studies, then they see that the drugs was most promising. So this is not strange for the scientific industry. What make people excited about this is that most time people who have diabetes on long term that on these medications, they end up with kidney issues. And there are a lot of stages to kidney damage. Stage 1, stage 2, stage 3, and stage 4. Then we start to monitor your creatine clearance, your BMR, to see how your kidney is functioning and all those kind of things. So scientists are always been focused on, look, how can we protect the kidney from damaging while with somebody that has diabetes. So they went back in their drugs database, they went back into their protocol and started looking at each of these diabetes drugs. And interestingly, there are two drugs that show very good effect when it comes to kidney. And the second one is depagliflozin from the SGLT2 inhibitors, which is Farxiga. But the thing about Farxiga is, for them to approve it for monograph, the clinical studies, they're doing it in larger populations. So when they do it in larger population, they have minimum effects. But with Ozempic, it's showing to them that, look, across all patients with all comorbidities, especially those that have severe kidney issues, is protecting them from kidney damage. So their renal physiology is being protected. And that is very good, because then it means that most people that are going to be on Ozempic don't have to worry about going to dialysis later on in the future, having acute kidney injury or chronic kidney injury. So those data are promising actually, but you can put a drugs on the market not looking at other effects. So they are looking at other comorbidities, other issues. But what I know for sure is it will be approved. I'm sure it will be because 80% of the study is showing that it's going to be approved for that, and then that will make it three things you're hating at once. You're hating the diabetes, you're hating the obesity, and then you're hating what? You can't eat.
Cardiovascular, which is also
So,
hitting kidneys. Yep.
so that reduces what we call polypharmacy, right?
Yeah.
We don't have to prescribe three different drugs for three different indications. Just give one drug and you cover it up. We're hoping that it happens. Like yesterday when I talked to since I was so excited, I thought FDA have approved it. But then when I was leaving today, I tried to check and I checked with my boss and said, no, Jeremiah, they want to escalate the trials because they don't want to put the drugs on the market and recall the drugs off the market. So, I mean, that's why it's not approved yet, but it's pre-approved for that indication.
The sad thing about that, I'm also a dialysis nurse.
Oh
And
my
see
God.
a vast difference with our patient, and the nephrologist now I'm being concerned because Ozempic want to take business away from us.
You're the pharmaceutical, you're just one said just.
No. So you see, the drug here will do chosen years, Jeremiah. The drug here, it will hit the thing so good. Cardiologists will get out of job.
Yes,
Nephrologists will get out of job.
yes,
Endocrinologists will get out of job. It will
yes.
be a problem. So I can see if they don't approve the drug, there's a good reason why. Because
No.
it's just hitting all the places
It
that
is,
makes money.
It is, and it will decrease.
Yeah, they will
the bariatric surgery.
Yes.
Because people.
That's what I'm saying. Yes, yes.
Yes.
Even transplant, will be surgery will reduce because most time when you have diabetes, some of your organs damaged, they have to do transplant.
Yes.
Yeah.
Yes. I'm telling you, this drug will follow here inside town.
And again, we want to put this disclaimer out there that in no way, shape, or form are we endorsing or are we being sponsored or sponsoring this. We are just giving knowledge to the public about this medication.
Yeah, for me, I'm in the pharmaceutical industry, more about making money, right? Since Fatia and Madam Pere. But on a realistic note, our patients come first, right?
Exactly. Yes.
There's no need for somebody to be on 4 or 5 medication. I've seen patients on, I've seen a patient on all start. Another one they call permethrin for weight loss. Accurately and scientifically, there's a disclaimer. If you take those drugs after saying that they don't work, you're not losing weight. So, but we have to put you on there because you want to lose weight, right? And then secondly, somebody come with acute kidney problem, right? You have to protect the kidney. Now, the reason that Ozempic is like a innovation, and like everybody is like, wow. Think about it. When you have diabetes, to protect your kidney and protect you from cholesterol, put you on what? Statins, right?
Yes.
Now, we don't have to be too worried about that. Just get one therapy.
Yep.
So it's going to be a lot of struggle and counterclaims within the pharmaceutical industry because some people want to make money. You're going to take a lot of how you call this thing, a lot of brands,
Businesses away. Yes.
businesses out of that.
You're hitting a lot of group.
Group.
I'm telling
So
you,
that's
Jeremiah,
why
it
it's
was
an
bad.
issue.
It was
Yeah.
bad because my nephrologist came to talk to the patients and we're talking about it. And he was saying, this is very serious because we noticed that we started having more AKI patients come in, whereby we don't just go collect AKI first off like that.
And
No.
when she says AKI, she's talking about acute kidney injury.
Kidney injury.
Yeah. And now we start collecting them because the business going backward. The patient
Yeah.
think about it. If all our kidney patient, ESRD patient gets better, our diabetic patient get better, our cardiovascular patient get better, there will be no business. There will be
Absolutely.
no business. Because these are
Absolutely.
the big dogs that makes the money.
Yes.
One renal patient, you know what you're gonna handle. Because
Yeah,
renal
exactly.
patient gotta go to dialysis. You know the cost of that. So can you imagine fixing that problem? I don't know about this, but we steady taking God, keep the work going so that people can, get what they need. But I don't know.
Yeah. So to be real, on a realistic note, other hospitals already started using Ozempic for that. And that's because it's true clinical trial, they ask for patient's consent. But people are reporting back accurate data that is helping them. I will I will give an example of hospital that already added to the formulary in Indiana. Here is Lutheran Hospital, Lutheran Health.
Okay.
Disclaimer, but I've seen the data and I see how many patients they are using on it, and they're getting lower rate. Doctors don't like that
No.
because you have to push the drugs for the pharmaceutical
That's how the
industry.
medical system was set up to do. Yes.
But on a realistic note, those that produce Ozempic going to push it. One of the company is the on Nova Daystar.
Yeah.
They are one of those that produce huge amount of Ozempic. So they know they're going to make money because everybody's going to run for their product. So guess what? They want it happen. But then other pharmaceutical companies that produce Fasiga, Janus, other drugs, metformin, they're going to say no. Let's see how we can do about this. So there's a lot of pull within the pharmaceutical industry right now, but I think Ozempic going to get approved.
But you know, the cost of it right now, and what people are hoping is that over time, probably the federal government will step in so the price can come down for everybody can be able to afford it. If that happens, we are in medical heaven.
Yes, but I can tell you when the drugs that come on the market, only those that can afford it for a long time, only those that can afford be having access to it. I will give an example.
True.
TCP, Trazepata, which is Monjero.
Yep.
You know the cost of Monjero if you want to buy a cash right now, $1,270 some dollars for one pen. You taking it only once a week, only because it has promising characteristics of what losing weight. Now compare it to Ozempic that are going to be protecting your kidney and other renal issues, right? So it's going to probably be expensive. So to be real, it will be very expensive, but those that are full can afford, yeah, because look at the cost benefit analysis, you're going to live longer.
Exactly.
Yes.
Yeah.
And
So
look at the bigger picture. Look at how much insurance companies are going to save from patients not being in the hospital,
Yes.
from
Oh
patients
my God.
not receiving dialysis. I mean, dialysis is a money making
Oh my
business.
God.
it's very expensive.
Yes.
Oh my God.
And
Very
they
expensive.
pay insurance, Medicare, Medicare. They pay 100%.
Yes. I mean,
And that procedure is very difficult too.
hire care coordinators to manage diabetic people so they don't go to hospital
Yes.
because the money is not easy. Because why they there, they have to get dialysis.
So
The thing is,
my research when I did it, Ozempic cost around $892 for a month
now
supply.
Yeah.
with
Yes,
other
that is without
indication,
insurance.
that's what
But
I'm saying.
the good thing is with insurance, most people pay a copay of $40,
Yeah.
which is affordable.
Yeah, but since I think about it this way, it costing $800 because it has two indications. It has diabetes and it has weight loss. And the only reason the cost of that therapy is at $800 is because other diabetes drugs like Ozempic, I mean like on the Monjero, do the same thing. That's the reason why it's 800. But if it comes to be where it protects your kidney for acute and chronic kidney injury, it's going to go to $2,000.
Wow.
Yeah, of course.
Yeah,
Because
but even at that,
even
to
at
me,
that,
the benefit outweighs the
always
cost.
the cost.
Yeah.
That particular
Yeah.
one, because I'm telling you, it's
100%.
crazy.
100%.
Crazy. Yeah.
Yeah. So it's good for us, the poor people, those that are poor and sick, but then it's not
No,
good for the
listen, I got
pharmaceutical
my
industry.
dialysis job. I need kidney problem. So
you,
Well,
you, hey, you,
from the provider standpoint, I want my patient to get well.
that's what I'm saying.
So
No,
forget
no
your
matter what, you will
dialysis.
not get no matter what, Madam Perry, you will not get a job.
I
You
know,
know,
but that one easy. I like it. They keep coming.
you know, my boss was telling me, he said, we were talking about, hey, he said, Jeremiah, good thing is, you in an area where you always be in demand.
Exactly.
And so you guys are in an area you always be in demand, so you don't have to worry about your job. Just worry about the patients.
No, the next thing we'll start hearing that we're gonna our sensors are getting low. Be like,
No.
oh Zampic, you know.
Yeah, that drug is a good. Few drugs, diabetic patient has so many drugs around.
Yes.
I like drugs business. I'm an area, but the thing is, when you see how people come to buy Ozempic and metformin, right? Oh my God,
It's amazing.
those drugs are the promising drugs that if you're not on, you need to ask your doctor. Maybe there's something else because if you have a diabetes, you want to be asking for Ozempic, you want to be asking for metformin.
Yeah.
Yeah, I always educate people. Oh, if you're taking metformin, it's okay. Just watch out for lactic acid acidosis, right, of your muscle. That's all you need to watch out for. Muscle cramping and stuff, and you can manage that. But other drugs have so many, how you call this guy, sexy now. I think you have it. The other diabetes drug make you pee pee all day. You don't want to be going to the bathroom. You overworking your kidney, right?
Yeah.
So Georgia Ozempic, then you want to be on them when you have diabetes. You know what I mean? So, and when with the kind of news we hear now, and the kind of thing that's going on within the scientific industry, that's a huge cutoff point for a lot of patients. A lot of people going to be happy and run for it. So you want that?
And no drug have ever caught my attention like this drug. Because it's like, that's what it do all day. But I was really happy for it, especially with all the areas that it's hitting. Those are very, very big areas in the health industry that racks up cost and kills people. The mortality rate with heart problem, kidney problem, diabetes
Hmm.
type 2 is a lot. And to have
You
a
know.
drug that say, okay, I'm gonna target this area for y'all, I think it's just
Hmm.
amazing.
And then you know that look at it this way with Ozempic is so amazing. And I would tell you one of the amazing things that I like when you have diabetes, right? Everybody know all your glucose, your sugar, insulin. Nobody focus on glucagon.
No.
And you can't go tell the common man about glucagon because you have to define it scientifically.
Yeah.
And glucagon through your intracellular level, it get converted into glucose because every time your insulin is taking the sugar from the blood, glucagon is putting it back, scrutiny from the pancreas and the liver and putting it back. So every time your sugar get low in the blood, glucagon goes all high, and then it calls for more sugar to come. So when the manufacturer was making Ozempic, when the scientific industry was making Ozempic, they fixed Ozempic specifically to be a glucagon-like peptide because those drugs are made out of a series of amino acids. So they are sequential amino acids that join together to make that. So what happens is they say, okay, we'll forget about insulin because we have so many insulin therapy, we'll make it for glucagon specifically, so that the reabsorption of glucagon is converting it from glucagon to glucose in your blood, so it can happen fast. It focus on that reabsorption. When we have that reabsorption, then there will be not a lot of blood in the glucose. But then later on, when they did that, they found out that, so when we inhibit the glucagon reabsorption conversion to glucose, there's a lot of mechanisms I don't want to go into. I cut it short. I just want to make it for a layman to understand it. So when we see that, there are not a glucose converted from your liver or your pancreas. So they say, now the person is losing weight, but they didn't understand why we're losing weight. Later on, they went back and found out that, the losing weight mechanism is coming from the reabsorption of glucagon to glucose. Now, for us to see now we have two indications: weight loss and diabetes. Then they see, boom, kidney function is protecting the kidney. What kind of drugs is this? If this drugs go through and that mechanism seems to be kidney function, when next function you can talk about, they start looking at cardiovascular functions. Because when your kidney go down, your heart start being affected because your heart have to start pumping more blood. So take time before the drug have 5 indications.
It's coming to that. That's why we are excited for it. Yeah,
Yeah,
it's a blessing.
Very, very amazing.
At this
it
point,
is.
it's a
It is.
blessing. Can you
It
imagine
is.
me? What lazy? I said I was thinking to myself, I still should go see my doctor and tell them to put me on Ozempic so I can lose weight. I said no, but I won't wait. You know how good thing come, you're all running there, and the next thing you know, they say,
You
now
better
they're gonna
you better go
require more. I'll
exercise.
be mad at myself because I can go do my exercise and take care of my problem
Yeah.
than to go add something there. But yeah, it's just very nice for once, you know, to be able to see that
So
something wants to help.
we can't talk about all the good things and not mention,
Yeah.
some of the what we call the contraindication, or the side
Yeah,
effects,
yeah, yeah.
from Ozempic. And one of the serious side effects is it can cause possible thyroid tumor or um, thyroid cancer. Okay, so that's why you have to make sure that you talk to your doctor, and your doctor has to make sure that you meet the criteria to be put on this medicine. You cannot just go to your doctor and say, "Oh, I'm obese and I want to be on this medicine." No, they have to do lab tests. They have to make sure that your pancreas is functioning. Your renal function is fine. They have to do some blood tests.
Yep.
So it's not something that you can just go and request and then we put you on it. No, that will not be safe
And
practice
two
at all.
and two, if you on thyroid medication, it's not recommended.
Right.
Hmm.
So, oh yeah, please, yeah, oh, before you get up and go say, and me, the way I don't want exercise, I still want to follow fufu in the night, I will go get my Ozempic and take it and then eat fufu, and your lifestyle has to change.
If
It
you're
is.
pregnant or breastfeeding, they don't put you on there. If you have a
No.
history of diabetic retinopathy, they don't put you on that. If you have problems with your pancreas or your kidneys, like we said, we don't put you on it. So we have to do some tests, and we have to do some great screening. Now, if you have those issues and you lie about it, well,
You're
you
looking
know,
for your own trouble.
yes.
Hey,
Yeah.
So
because with every
So
good thing comes the other side. Life has to be balanced. Yeah.
it is.
Well, Jeremiah, thank you
thank
so
you so
much for
much.
coming on and
Yes.
us talking about this. And we keep reiterating that we are in no way, shape, or form promoting this drug. We're just educating, and that's our job to educate
And
the
that's the
public.
thing. If you're in the pharmaceutical industry, you can't just start promoting drugs. You can't just start. That's the reason sometimes when we're talking about it, we try to see how much information we can put out there, how much information we should, exclude
Yeah.
out of our discussion. Because if you and myself are in a room with all scientific or medical guru, we start diving and deep diving into other issues. But pharmaceutical companies, they have confidentiality. Okay, and you can say certain things, you can say certain things. It's like a society bush. So yeah,
Yeah,
so
this is just
yeah,
this is just for education.
Yeah.
it's just for education. It's just for
Yes,
education.
if you are a diabetic, if you are obese, if you have cardiovascular issues, and you go to your doctor, it's something for you to talk to your doctor about. Now you've heard about this medication, you can go and have a conversation with your doctor, and
Yes.
run some tests, and if you fit the criteria, they could put you on it. So
Uh, and since I said before I leave, I know we've been on bigger disease stage sometimes, but I will advise that we go to basic OTC. I was saying that on the show. I mean, basic OTC, women health, men's health. You know how people get common allergies and they confuse between Claritin and Zyrtec and all this. What they themselves self self prescribe. I know this one we had to go through data and stuff. You know how some people get yeast infections, some women they could go over the counter and get some kind of azo or something, you know what I mean?
yeah,
So sometimes we just have to be focused on the NPT, which is non-prescription therapeutics. When you have itch on your skin, you have less in your hair because our show in America, you gotta go to doctor diagnose it, right? But the people in Liberia that are watching the show,
Yeah.
when they can get less in their hair then. So sometimes we talk about hair less,
Yeah.
what cause hair less,
that is
and
true.
then what is
Feel
it?
free.
They
It's
talk
just
with
a
If you
us.
come
yeah, it's
on,
just a
yes,
form of
feel free.
confusion.
Just let us know. And you're right.
Yeah.
Back in third world countries, they don't have that accessibility. So
Yeah,
we
ring
improvise.
running, ring running, ring running, hygiene. You can call something. Yeah, you can teach them how to. take shower, clean yourself. That basic non-pharmacological therapy that they can do because they can't afford it. We're not changing the whole thing, but just basic thing that you can just go over the counter when you have
You
fever
know, like the fungal
and stuff
infection
like
that you
that.
get on your skin back home, we call it dishcloth. You know,
Yeah.
Yeah,
that
It's
is a
tinea
fungal.
versicolor.
Yes,
Yeah.
that's a fungal infection. But back
yeah,
home, we don't know. We just say, oh, the person got dishcloth, and there's a simple cure for that.
Yeah.
You know, but they
yes.
don't know, and this thing
I
has
don't know.
consumed their entire body.
Yeah.
Hmm.
You know, so yeah,
The
you're
reason I
right.
say that most of our people not let insurance benefit. They will say
True.
they did it. So somebody that can do their own over the counter. Maybe when they hear you talking about that dishcloth thing, educating them. Maybe take shower 2 times a day, shop, wrap some hydrocorozones and stuff like that on you, something like
Good
that.
soap.
Hmm.
Cleaning.
So usually the tinea vesicola, usually because it's from moisture. Fungus
Yeah.
likes
Heat.
moisture.
Yeah.
So if let's
Yes,
just say you play basketball and you sweat in the jersey, or you play soccer, football, and you sweat in the jersey, instead of changing that jersey, you stay in that jersey all day. You put yourself at risk for developing that, because fungus
yes.
feed on moisture.
And
I'm
dirt.
not sure, yeah. Hmm.
Well, this evening has been so fast spent, and we don't want to go because we in the area we love to talk about, but we have to go.
All
So,
right.
thank you for listening this evening. A hint to the wise
It's quite
is
sufficient.
quite
That's like
sufficient.
sufficient.
We're not
These
going to
people,
beat a willing house, but we just
okay, I'm about to leave first and leave you on your show.
Thank you
But
so much.
to be real, these people are doing well for our community as a whole. Sis Pasia and Madame Pede. It is actually, I like to watch a show sometime because they exchange of medical knowledge. And the thing I like to watch a show for too is when Sis Pasia to a working place, she can be speaking series. Madame Pede can be speaking series. When the white people can be talking to American people. So they want our own people who talking to us who can talk certain way,
oh yes.
Yeah.
Yeah.
No,
So
but let me tell you the
no.
funny thing,
So
Jeremiah. My students were like, "Oh, Professor Pele, can we watch this show?" I start thinking in my mind, why some would they understand
oh,
everything? But oh yeah, they will.
uh,
But now they pay.
when we start having more view, if we start having more view, we start to standardize how we talking for everybody. You don't have to speak series, but just standardize the way we communicating. So this show for me is important for our community. Most time people want to listen to politics. Even me, to get views, I have to discuss politics, but politics is not my area. This is our area, you know what I mean? But when you're not talking politics, you're not talking to anything, people don't listen.
They don't
But this
listen.
is actually, without your help, n- nothing is, you can do nothing in the absence of good health. But until we can reinforce these things in our society, we will not get anywhere. So I really appreciate the show, and I will always be waiting when you guys call me because the fact that I gotta go look out some things and ask some experts are also learning
And
and
also
it's
expand your knowledge.
important.
Yep.
Yes.
Yeah, and our people as well, they can relate to us the way we talk to them. The old Jeremiah say this, Madam Peter say this, his Pasia say they will say that. So let's keep up. No matter view, 2, 3 views. Some people can go spy when they're
No, we got
sleeping in there.
numbers. No,
Yeah,
we gotta
12
get our
midnight.
numbers.
Yeah, some people 12 midnight and when they can start watching. You know what I mean? So
I
yeah, let's
agree.
just keep
Yeah,
it
because
up, and I really
I
appreciate
noticed
it.
that all the time. Shows from before got more ratings, and I like, okay, when did
Hmm.
it go there? But because it's live and it's in the cloud, people look when they look.
And
So
let me know if
yeah,
you if you
yeah,
need
we
me
are just
if you need me to have some of my friends from different background on different topics to appear with you.
No, you let us know
Yeah,
whenever you're ready. We
I
are
can do
ready.
that.
Just let us know.
I have
yeah.
Let us
I
know.
have friends that can do that. Some of them they are MDs, some of them they are anesthesiologists, some of them they are neurosurgeons. They can come on the show and just educate us on other issues. I can make that
Any
connection,
topic they want
and
to
they can just
educate
come for 30 minutes.
us on, please let us
Mhm.
know. You just let us know. We'll bring them on.
Because
Okay,
at the
Whatever
end
thank
of the
you.
topic they
day,
want.
it was great on.
Thank you, man. You guys take care.
All right.
Alrighty. Well,
Well, folks,
it doesn't matter what you've been going through.
or what you have been through,
Thank
thank
God,
God
it is
it's
fabulous. Have a blessed evening. Remember, eat well, exercise, sleep well,
And
and love
drink,
each other.
drink enough water.
Water.
Yes. And then, and just a side note, tomorrow is the funeral, the homegoing of Mrs. Ayo Zogbo. She is the wife of John Zogbo in the Liberian community. And so the funeral will be held at Fall Creek Church of Christ on Fall Creek at 10 o'clock is the viewing, and the service is at 12 noon tomorrow.
All right. Thank you, viewers. Have a good evening.
Good night.